What is rehab or rehabilitation? My name is Fred Begaris, a board-certified sports and spine medicine physician in Virginia Beach, Virginia. After 10 years of practice, I still find musculoskeletal medicine both fascinating and challenging. This podcast is about the lingering thoughts and questions I've had after residency and fellowship. My hope is to spark discussion, challenge dogma, and share my experiences in musculoskeletal medicine. Welcome to the Talking Rehab podcast. Rehabilitation is really about change. Even if you fell and broke a bone, it's not necessarily just about healing and picking up where you started or picking up where you left off. It's really about learning and also how to make changes. One of my favorite quotes that kind of inspired this podcast is by Tim Grover, who said, "If you think that the price of winning is too high, wait until you get the bill from regret." And he was talking from a coaching and performance standpoint, but I think this does apply pretty well to the mindset of rehabilitation and pain and injuries, because many of the people I see have essentially complex injuries, or they have conditions that have been undiagnosed even after seeing several physicians, a lot of testing, a lot of frustration, and they don't have a clear diagnosis or pathway. Many of them receive a lot of different treatment options. Some people have the courage to make tough decisions. Some folks opt to get a second opinion, a third opinion, and ultimately put off surgeries, put off injections, put off medications. And that's really that's the topic of today's podcast. Is we're not talking necessarily of the bill of regret, but what is the bill of not changing or not actually doing anything? One of the common questions and conditions I see is knee osteoarthritis and whether or not to get a knee replacement, or have a history of a lumbar disc herniation and whether or not to move forward with a surgery. And of course, I'm not talking about jumping into surgeries. These are folks that have done all the conservative stuff and they're not responding, and yet they're faced with this tough decision on whether or not to do an invasive procedure. So of course, we get tests and things like that, images, MRIs, CAT scans, hoping that it makes the decision easier. And then we also lean on physicians to help make that actual decision. And outside of a life and death situation, it's really highly dependent on the person or the patient to take a step forward. And physicians obviously are always going to try to be objective, but advocate, but it's ultimately our patient's decision. And it can be tough and scary. So a lot of people opt to not do anything, stay the course, maybe get another opinion. And I've started to ask my patients, well, okay, that's fine, but what is the bill of not doing anything? Is waiting necessarily better than actually doing something? And I started to appreciate and explain to patients what is going on by not doing anything. And I've kind of broken it down into a couple different things. There is consequence of being inactive or being relatively sedentary. Obviously, when people are in pain, they tend to move less. When people are in chronic pain, it affects their mood. So that from a physical standpoint leads people to become generally less active. And as a result, it affects different parts of the body. The muscles in particular, they become very atrophied. The older that we get, we tend to lose muscle mass much faster. Obviously, when you're 20 years old, you get injured, you could be down for 2 to 3 weeks and have relatively low muscle mass. You can have relatively minimal atrophy or muscle loss in that amount of time. But when you're in your 40 plus years and you are off of your leg for even like 3 to 4 days, the atrophy actually accelerates. It becomes much, much more apparent. As a result, that makes standing, walking, climbing, let alone sporting activities more difficult to get back to. So even with some of the conservative treatment options for non-surgical issues, I often will encourage people to stay physically active, go to physical therapy, while they have symptoms such as pain. And I get a lot of pushback, which is fine. It's because, again, the focus is on the pain. I don't see the value of doing this treatment because I still have the pain. And, atrophy is definitely one of them, along with these other features. Um, Joint contractures can also become a problem. Um, when people become less active, the ligaments and the general tissues around these normally movable structures become stiff and rigid, and that makes generally moving difficult, even when there's no pain. So as an example, if you had someone who had a pneumonia, was stuck in the hospital for 2 weeks, they couldn't move. You can imagine what standing up and trying to move their joints feels like. Even in the morning when people wake up, the first thing that everyone does is do a nice long big stretch. Now imagine being on your back or sleep or essentially kind of in a frozen position due to an injury for months or even years. What does your joint look like? The atrophy, the joint contractures can also develop into abnormal mechanics. So, obviously, when people move, they tend to use, relatively normal mechanics, which as a byproduct, people become very efficient in their gait. But when things become asymmetric, one side it moves more than the other, the mechanics start to change. And the abnormal mechanics contribute to, essentially people feeling weak, feeling tired because they are using so much more effort to move forward with abnormal mechanics that it's no longer energy efficient for them. So they can actually feel very tired. And the abnormal mechanics will put stress and pressure on joints, tendons, and ligaments that are now being exposed to kind of atypical pressures through these structures. And so the question is, are our joints designed to withstand abnormal biomechanics for long periods of time? Can it potentially contribute to further wear and tear of that particular structure? Um, I bring this up a lot when people have joint arthritis. One of the major goals with pain control and physical therapy and encouraging people to stay physically active is to make the mechanics of arthritis and pain more normal, essentially trying to reverse the compensatory patterns that have developed as a result of the pain and the loss of cartilage. And it can be tough because, the obviously people focus primarily on the pain part of things because that's on the forefront most of the time. Being sedentary has its separate medical issues that can develop. People will start to have cardiovascular problems, develop high blood pressure, insulin resistance starts to increase. So the chances of developing diabetes becomes higher. Sometimes your blood sugars, if you do have diabetes, become uh, harder to control because you're no longer moving. You're expending less energy, potentially not decreasing your caloric intake. You're also losing muscle mass, and those are all factors that affect glucose metabolism. One of the more obvious things that can happen, even though I mentioned it last, is that the pain can actually feel worse. So most people will essentially stop moving. They'll see different doctors. They'll get different treatments to manage the pain. But sometimes people will opt to move less, and that's their movement. That's their pain strategy, is to be less active. And that unfortunately does the opposite in a majority of the cases that I see. When people slow down with time, their pain actually gets much, much worse. They start to develop not only pain in the primary structure, like the knee, someone who is limping will start to develop hip pain. than back pain because of, again, potentially of the abnormal mechanics. You have developed a new compensatory pattern, which is now putting stress on body parts that were not designed to be used that way. There's also the neural connections. When people are in pain for long periods of time, the neural connections from that make the pain pathway actually start to get hardwired. And that's obviously a bad thing because now what can happen is that, normal movements now trigger pain. Normal pressures are much more painful. So it's like everything is just much, much more painful. Difficult. The neurologic pathway is much more primed for to fire with regular movements, regular stimulus. And the way back from that, even if let's say that you have years of chronic pain and then all of a sudden, something magical happens and the pain completely goes away, reversing that hardwire neural pattern doesn't just go away, with the miracle cure. You have to undo that. You have to retrain it. So you actually have to lean into it. You have to get your body used to experiencing pain with normal movements, and then eventually the pain starts to decrease. So it's not always talked about because a lot of the focus in the clinics is on the structural piece and the pain, but there are consequences to being relatively less active. The last part I'll talk about is kind of the quality of life and probably the most important part of things. Again, we're talking about what is the bill of regret, what is the bill of not changing. There's the vacations, the holidays, the graduations, the sporting events. I ask people, how many more vacations are you not going to go on before you actually do something about your knee or about your back? I'm not trying to say that this is a simple decision. It's a hard one, but it's an important question that physicians and any clinician should start to put onto our patients and ask them, like, even in medicine, which really operates in the uncertainty business, there's calculated risk and sometimes there's just unknowns that can't be explained. How much more of your life are you going to live on pause before you actually start to do something and make a change? And at this time, I'd like to try and leave you guys with a topic or something to think about. So I started off with a quote and I will end with a quote. So the first quote, just to reiterate, is if you think that the price of winning, or in this case, the price of change is too high, wait until you get the bill for not changing. On the same note, here's the ending quote. Whatever you are not changing, you are choosing. I thought that this was a really powerful quote as well because I think staying the course, doing the same thing feels comfortable and safe, but in reality, it's still a choice and it may not be the best option when you think about all of the consequences that come with not changing. I hope I gave you guys something to think about. Thanks again for listening. Thank you for listening to the Talking Rehab podcast. I hope that this podcast stimulates you to question your own practice and how you approach rehabilitation. I truly appreciate your time and attention. If you enjoyed listening, make sure to like and subscribe to the podcast. I wish you a movement-filled day. Take care.